My name is Caitlin Owens. I am applying for the post-BSN Doctorate of Nursing Practice Family Nurse Practitioner program. I've been a nurse for 3 years. 2.5 of those were on the cardiac step-down at Intermountain Medical Center. On that unit, I got a lot of experience with taking care of high acuity patients, patients on complicated drips, patients coming straight out of surgery. I got very used to paying very close attention to my patients while I was working on this unit. Recently, I transferred to float pool, and I am learning so much every day about so many different areas of medicine. So the FNP and DNP role. To me, the DNP role is a leadership role within the field. These individuals are industry experts, and they can take on a wide variety of roles. They can be unit leadership, hospital leadership. They can work in advanced nursing practice, education. They can work at colleges. And then with changes in FNP education preferences, I really would like to get a doctorate degree. The FNP role is much more patient-facing, and it provides a high level of nursing care. FNPs work closely with doctors, and they can work in a wide variety of care settings. This can be anything from primary care and urgent care to sometimes they work in the hospitals, sometimes they can work for insurance companies, many different things. FNPs are responsible for a significant level of medical decision making, and so it's very important for them to keep up to date with knowledge as it changes and for them to be very knowledgeable. What I bring to the FNP role. So I am very passionate about learning, and my favorite part about working in medicine is working with the patients. I feel like I learn so much from them. Recently, I had an experience with a patient where he needed a liver transplant, and I had him before and after the liver transplant in 2 different departments. And before the liver transplant, he was really very, very sick. He wasn't able to get out of bed, wasn't able to do anything. And then I had him again in rehab after his liver transplant, and he was walking. He was like going through the whole thing of like trying to get in the car, and it was just so meaningful and so crazy to see how different this person's life was before and after the liver transplant. And that is so meaningful to me. It's also can be really meaningful to sit with patients when they are going through difficult times. I think that I have a broad medical experience. With my cardiac step-down experience, I have a lot of high acuity experience, and then with float pool, I have a very broad medical background. Since I started working in medicine, I've been very focused on biopsychosocial medicine. I worked in nutrition during nursing school, and I have volunteered at a free and low-cost clinic. And I also have a positive psychology certificate that I got in my undergraduate program. My career and the community. So I view a DNP degree as a next step in my nursing career. I am excited about the idea of learning topics more in depth. DNPs aren't just leaders in nursing, they're leaders in their community, and many communities in Utah are experiencing limited access to healthcare. A lot of rural communities don't have advanced practice providers living in the community, and so they have to travel very far for doctors. Other communities have issues where people can't afford to see doctors, or they still just have to travel far. Having more FNPs would improve access to care in Utah. Traditional healthcare is also pretty focused on just treating the problems that patients have. If you have a medical issue, they'll treat it, they'll send you home. Whereas biopsychosocial medicine is much more focused on patients' overall health and what is causing them to make the decisions that they're making or to have the health conditions that they're having. So it could be very focused on, do they have access to medications? Can they afford medications? Do they understand their dietary restrictions? Are there barriers to them seeing a doctor? Do they have housing? This is really the direction that medicine is headed in, and I am very excited to be a part of that. Weber State is my first choice for a DNP program, and I would be super honored if I got accepted to this program.